So picture this. It's 1792, and a Parisian doctor named Philip Panel walks into an actual, literal dungeon.
Right, an asylum. Just a deeply dark place.
Exactly. And he's surrounded by people who are chained to the stone walls. They're being flogged daily and just treated like possessed animals.
Which was the standard of care at the time, sadly.
It was. But then he does the unthinkable. He just takes off their chains. He didn't use, like, exorcisms or medicine. He just moved them to clean rooms.
He let the sunlight in.
Yeah, sunlight and basic human kindness. And skeptics thought he was an absolute madman for unchaining them, right? But the experiment worked.
It did. Many of those people who had been completely written off as hopelessly insane, they improved enough to just walk out and return to their lives.
Which is just wild to think about.
It was one of the most striking turning points in medical history, really. I mean, Pinel basically proved that our environment and just compassion play a massive structural role in mental stability.
And that gets right to the heart of what we are doing today. We are welcoming you, yes, you, listening right now, the third person in the room with us, to a deep dive.
A very deep dive today.
Oh, absolutely. We're getting into the bizarre, the dark, and ultimately the hopeful history of how we treat the human mind when things go wrong.
Based on a really comprehensive psychology textbook chapter, right?
Exactly. We are pulling from a mountain of historical records, clinical case studies, and some major modern psychological debates.
And our mission here is to extract the most practical, evidence-based insights from all of that.
Right, because the goal isn't just to look backward like a history class. It's to figure out how you can apply these paradigms to your own psychological well-being right now.
Because, to understand the modern landscape of mental health, you really have to recognize one overarching pattern.
What's that?
Throughout history, the way we treat mental illness has always been entirely dictated by what society believes causes it in the first place.
Wow. Okay, yeah.
Our medical approaches are just a direct reflection of our cultural beliefs.
Which means if you trace the timeline back, you see some really wild swings.
Oh, for sure.
Take the ancient world, for example. The Greek physician Hippocrates was honestly incredibly progressive.
He was. He believed unusual behaviors were just a biological disturbance, like specifically an imbalance of the 4 bodily fluids or the humors.
Right. And because his foundational belief was rooted in the physical body, his prescribed treatments were incredibly humane.
Yes. If you were suffering psychologically back then, Hippocrates would prescribe, pleasant surroundings, exercise.
A good diet, massage, soothing baths.
I mean, it sounds like a modern luxury spa retreat.
It really does. Sign me up for that treatment.
But, that progressive biological view completely collapsed when the Roman Empire fell.
Right, moving into the Middle Ages.
Exactly. Scientific inquiry was largely replaced by theological dogma. So society suddenly believed mental illness was the result of demonic possession.
Or that people were in league with supernatural evil, right?
Yeah. And because the belief shifted to supernatural evil, the treatment shifted to extreme cruelty.
Because you had to punish the devil out of the patient.
Exactly. So the mentally ill were starved, they were burned, and locked in the exact kinds of filthy dungeons that Philip Pinel eventually walked into centuries later.
That is just so incredibly dark.
It is. And honestly, it wasn't until the 1960s that we saw a structural shift as dramatic as Pinel unchaining those patients.
You're talking about the deinstitutionalization movement.
Yes, which was fueled by a massive biological breakthrough, the invention of chlorpromazine.
The first true antipsychotic drug.
Right. Suddenly, doctors had a pill that could actually relieve severe anxiety and reduce psychotic behavior.
And this created a massive wave of optimism, didn't it? The prevailing thought became, like, why lock patients away in massive, expensive hospitals when they can just take medication?
Right, treat them as outpatients in their own communities.
Which sounds great on paper.
It does, but that optimism was laced with hubris. We created this false equivalence, assuming that a pill could entirely replace holistic care.
And the global data on this transition is fascinating in the text.
Oh, totally. If you look at Sweden today, there are practically no specialized psychiatric hospitals.
Right.
Patients are fully integrated and treated in general hospitals.
Oh.
Yeah. But conversely, you look at the Russian Federation, and they maintain the highest number of inpatient psychiatric beds of any major developed nation.
And that contrast really highlights the fallout of deinstitutionalization.
It really goes.
Because for a lot of people, returning to the community with medication worked beautifully, but the overall movement was never adequately funded.
No, not at all.
Without proper outpatient therapy, without monitoring, without help finding housing and jobs, it created a massive crisis.
Okay, let's unpack this for a second.
Yeah, please.
Was deinstitutionalization essentially like tearing down your old house before the new one was built?
Oh, that is a great analogy.
Because we dismantled the asylum system, which, yes, was certainly flawed. But we didn't build a robust community support infrastructure to replace it.
And that is the tragedy of it, yes. It created a revolving door existence for so many people.
Right. They go into an emergency room in crisis. They get stabilized on
They
medication.
get discharged to the street with no support. They stop taking the medication, and then they end up right back in the emergency room.
It's a brutal cycle.
Yeah.
And this brings up a massive ethical bind in the modern day.
Yeah, the text talks about this. Because we see so many individuals with severe mental health issues on the streets today, there's a growing push for reinstitutionalization.
Essentially forcing people back into mandatory care.
But that clashes violently with a person's civil right to liberty.
Exactly. I mean, do you involuntarily commit someone simply because they aren't adjusting to society?
Right. Especially when the clinical data shows that fewer than 5% of individuals with serious mental health problems commit violent crimes after discharge.
They aren't inherently dangerous. They're just completely unsupported.
Precisely. Stripping away someone's liberty because society failed to build that new house of community care, it's a profound ethical dilemma.
It really is. So with all these patients moved out of asylums and into the community in the late 20th century, psychologists suddenly had a very practical problem.
They needed structured ways to treat people on an outpatient basis.
Exactly. And this triggered an absolute explosion of different talking cures.
Which is where we see the major schools of therapy emerge.
Right. The most famous, of course, being Sigmund Freud's psychodynamic approach.
Oh, yeah. Operating on the assumption that your current problems are driven by unconscious childhood conflicts.
This is your classic lay on the couch and talk therapy.
But the mechanics of it are wild, like Freud used dream analysis.
Yes, he distinguished between the manifest content, which is just the literal stuff happening in the dream.
Like dreaming about driving a car.
Right. Versus the latent content, which is the hidden, terrifying, unconscious wish it actually represents.
Right. And crucially, psychoanalysis relies on transference, right?
Yes. Transference is this psychological mechanism where the client projects the intense feelings they have about, say, a parent or a spouse directly onto the therapist.
The therapist essentially becomes a blank screen for the patient's unresolved trauma.
It's incredibly intense.
Yeah.
And frankly, some argue it's a bit arrogant.
Because the therapist holds all the answers and just interprets your mind for you.
Exactly. Which is why I love the friction between that and humanistic therapy.
Championed by psychologists like Carl Rogers, right?
Yes. Rogers looked at Freud's model and basically democratized it. He flipped the script entirely.
I love that.
In the humanistic model, the therapist is no longer this all-knowing expert. They are just a facilitator.
They offer empathy, unconditional positive regard, and warmth.
Right. The core belief is that you, the client, are the ultimate expert on yourself.
It's a massive shift in agency. The humanistic approach just assumes you have a natural tendency toward growth.
And the therapist is just providing a safe greenhouse for you to untangle your own roots.
That's a beautiful way to put it. But then you have the behaviorists.
Oh, the behaviorists. They look at both Freud and Rogers and say, you're both wasting time.
Right, they throw out the unconscious mind and emotional introspection entirely.
They don't care why you have a problem. They only care about how to change your learned actions.
Like, if you have a severe phobia of spiders, a behavior therapist doesn't care what a spider represents in your childhood trauma.
Exactly. They just want to rewire your physical reaction using systematic desensitization.
And neurologically, what they are doing is forcing the brain's amygdala to uncouple the visual stimulus from the panic response.
Right. They teach you deep muscle relaxation first. Then they introduce the stimulus incrementally.
So first, you look at a picture of a spider while maintaining that relaxed state.
Then maybe a spider in a glass cage across the room.
And eventually you work all the way up to holding a spider. You are mechanically overriding the fear response.
It's pure conditioning. The same goes for selective reinforcement.
Like if you have a hyperactive 9-year-old girl at school, you use a token economy.
Right. She gets a poker chip for paying attention, which she can trade in for a reward later. You are just training the behavior.
But of course, humans are more complex than Pavlov's dogs.
We are, thankfully.
Yeah.
Which brings us to the most dominant modern model cognitive behavioral therapy, or CBT.
Yeah, CBT acknowledges that you can't just condition the body. You have to fix the thoughts driving the behavior.
There's a classic clinical example in the text that perfectly illustrates this.
Oh, the Raymond example.
Yes, imagine a CBT session with a suicidal woman whose core belief is, I can't be happy without Raymond.
Okay.
Instead of analyzing her childhood, the therapist uses Socratic questioning.
He asks her, were you happy before you met Raymond?
And she says yes.
Yeah.
Then he asks, do you have a real marriage now?
And she admits she doesn't. They fight all the time.
Yeah.
And he's unfaithful.
Slowly, just by asking relentless, logical questions, the therapist forces her to realize that her core belief about Raymond is objectively, factually false.
It's a really powerful demonstration of how we torture ourselves with irrational expectations.
We really do. We build these internal, absolute rules that just do not reflect reality.
So if behavior therapy is like training a dog to sit, CBT is more like debugging a computer program where the faulty code is your own internal monologue.
That is a perfect way to look at it.
Yes.
But with one agonizing caveat.
What's that?
Unlike a computer, your brain actively resists being debugged.
Oh, right.
You are dealing with neural pathways that have been heavily myelinated over decades. It's not just a matter of finding the bad line of code and hitting delete.
It's the exhausting daily work of forcing your brain to run a new, unfamiliar program until the old toxic pathways finally atrophy. I want to pause here and ask you, the listener, to think about your own Raymonds. What are the irrational beliefs or absolute rules you set up in your head that you treat as undeniable facts but are actually just heavily myelinated, faulty code?
It is an uncomfortable but really necessary exercise to do.
For sure.
But we also have to acknowledge a hard limit here. Talking cures are incredibly effective, but sometimes a patient cannot simply think their way out of a problem.
Right. When the software of the mind is irrecoverably corrupted by a physical illness, you have to look at the biological hardware.
And that leads us to the physical interventions,
which operate on the assumption that mental health problems are caused by biochemical dysfunctions.
Exactly. Like we have antipsychotics, which work by blocking dopamine receptors in the brain to treat schizophrenia.
But interfering with the brain's dopamine pathways comes with brutal trade-offs, doesn't it?
It does. Long-term use can cause tardive dyskinesia, which involves involuntary, repetitive facial movements.
It's a severe physical side effect, and one that carries a heavy social stigma, too.
You also have SSRI antidepressants, which prevent the reuptake of serotonin so more of it stays active in your brain.
And lithium, which stabilizes the extreme neurochemical mood swings of bipolar disorder.
But the one that always shocks people when they learn about modern treatments is electroconvulsive therapy, or ECT.
Yeah, because pop culture has painted ECT as this barbaric torture device from the 1950s asylums.
Right. But modern ECT is surprisingly successful for severe treatment-resistant depression.
And the mechanism is fascinating. They use short-acting anesthesia and muscle relaxants so the body doesn't thrash around.
Then they induce a highly controlled seizure.
It's essentially rebooting the brain's neurotransmitters.
Yeah.
And it floods the brain with neurotrophic factors that encourage new neural growth.
The evolution of ECT is a perfect example of refining a biological tool. But, biology rarely works in a vacuum.
Very true.
Let's look at a well-known clinical profile from the literature, often referred to as the case of Steve M.
Okay, yes. He's a man with paranoid schizophrenia who believed a transmitter was literally implanted in his head.
Right, broadcasting voices that constantly berated him.
For Steve, medication isn't optional. It's vital.
The psychotherapeutic drugs quiet the voices and reduce the paranoia.
But the drugs don't teach him how to rebuild his life. He requires a combination of therapies.
Yes. He needs the hardware, fix the drugs to stabilize his neurochemistry.
But he needs the software-fixed psychotherapy to manage the crushing stigma of his illness, rebuild trust with his family, and learn how to reality check his own thoughts.
It requires an integrated approach.
For sure.
But just as Western medicine is refining these highly technical biological interventions, psychological research is heavily investing in the third wave of therapy.
Which feels like the complete opposite approach.
It really does. I'm talking about mindfulness.
Here's where it gets really interesting for me. Programs like mindfulness-based stress reduction, or ACT, are deeply rooted in Buddhist philosophy.
Right. The core idea is that suffering is inevitable, and our true pain actually comes from our frantic attempts to avoid or fix that suffering.
So instead of taking a pill to numb it or using CBT to debug the thought, Mindfulness teaches you to just be with the suffering.
To sit with the anxiety or sadness without trying to change it.
It is a profound departure from the traditional Western therapeutic model.
Which is entirely based on identifying a problem and eradicating it.
But I have to push back on this a bit.
Go for it.
Isn't there a massive sociocultural blind spot here? I mean, isn't it a bit of a cop-out to tell someone who is living in crushing poverty or facing systemic discrimination to just be mindful of their stress and sit with their suffering?
That's a very fair question.
Instead of, fixing the outside world that is actively causing that suffering.
Your pushback is entirely valid, and modern clinical theory absolutely acknowledges it. A purely internal focus is dangerous if it ignores reality.
Right.
True therapy must operate on a biopsychosocial model. You cannot tell someone their fear is all in their mind when there's a literal tiger in the room.
Yes, exactly.
Mindfulness is an exceptional tool for managing your internal reaction to stress, but it can never replace the necessary material work of changing toxic external environments.
Okay, that makes a lot of sense. And that tension between fixing the internal biology versus changing the external behavior perfectly sets the stage for one of the most heavily polarized debates in clinical psychology today.
Oh, yes. How to treat addiction.
It is a massive area of disagreement with completely competing data sets in the source material.
It is.
So let's look at the two opposing paradigms. And obviously, we're just laying out what the text says here.
Right, impartially.
Yes. On one side, you have the traditional abstinence models like Alcoholics Anonymous or AA.
And researchers like Keith Humphreys point out that AA is a remarkably effective, evidence-based intervention.
It's a worldwide fellowship that is completely free of charge.
Which, when you factor in the exorbitant cost of modern healthcare, is revolutionary.
Absolutely.
Humphreys points to rigorous clinical trials showing AA yields highly effective long-term abstinence.
Because it's free and peer-supported, the text notes it actually reduces healthcare costs by roughly 45% compared to professional outpatient treatment.
It works by building vital coping skills and replacing a network of drinking friends with a sober support system.
And it also heavily relies on building self-efficacy.
Right, the genuine internalized belief in your own capacity to maintain your sobriety.
But then you have researchers like GL and Marlett who look at the exact same addiction landscape and point out a massive flaw in the AA model.
The dropout rate.
Yeah. Basically, for every 2 people who attend a first meeting, only 1 returns.
Marlett argues that AA's disease model is fundamentally alienating.
Because the traditional AA model requires members to admit they are totally powerless over alcohol.
And to surrender to a higher power.
Right. And for a lot of people, that required loss of personal agency is just unacceptable.
Furthermore, AA demands absolute lifelong abstinence. Once an alcoholic, always an alcoholic.
Because of this, we've seen the rise of alternatives like smart recovery.
Which uses CBT printers instead of a higher power.
But the most radical shift in the field that the text brings up is the harm reduction model.
Harm reduction is a complete paradigm shift.
Yeah. Instead of demanding total, lifelong abstinence, which in the AA model often requires a person to hit absolute rock bottom before they're ready to surrender, harm reduction focuses purely on minimizing the damage.
A great example in the text is how we treat high-risk college students.
Right.
Under a traditional model, you'd tell a freshman who had a bad night to just never drink again.
But a harm reduction program takes a different approach entirely. It teaches them safe drinking skills.
They learn about blood alcohol levels, how to pace themselves, and how to eat before drinking.
And the clinical data shows that this pragmatic approach significantly reduces binge drinking, blackouts, and acts of vandalism.
Because it meets people exactly where they are.
Exactly. If someone refuses to abstain completely, the harm reduction model simply asks, okay, how can we make this behavior less dangerous to you and to society?
Think about it. It really comes down to how you view human nature.
Mm-hmm.
Is addiction a binary switch where you are entirely powerless, as AA suggests? Or is it a volume dial that you can learn to turn down, as the harm reduction model argues? Navigating all these different philosophies, whether it's the volume dial of harm reduction, the debugging of CBT, the hardware fixes of biological psychiatry, or the acceptance of mindfulness, it can feel overwhelming.
Which brings us to the real-world application.
The most important part.
Right. How do we synthesize all these historical shifts and clinical debates into something personal for your daily life?
Based on decades of research, psychologists often point to 5 concrete steps for enhancing personal mental health.
First, accept your feelings.
Unpleasant emotions are normal.
Yeah. If you force a false cool or try to suppress every negative thought, you just cause collateral damage. You end up numbing your capacity to feel joy, too.
Second, know your vulnerabilities. Pinpoint the specific situations, environments, or people that trigger your anxiety.
And make active, strategic plans to manage those stressors before they happen.
Third, develop your talents.
And I really want to highlight the psychology behind that third point.
Oh, it's fascinating.
Research explicitly links boredom with unhappiness. Why? Because an understimulated mind turns inward and begins to cannibalize itself with anxiety.
Building competence in a hobby or skill anchors your mind and bolsters your self-esteem.
Exactly. Fourth, become involved with others.
Isolation is toxic to the human brain. We are profoundly social creatures.
And finally, fifth, know when to seek professional help.
It is a sign of immense emotional maturity, not weakness, to realize that you cannot objectively view your own cognitive blind spots.
So what does this all mean for you?
It means viewing these 5 steps not as some generic checklist, but as active daily armor.
They are actionable ways to build psychological resilience against a world that is inherently chaotic.
You are taking control of your own well-being using the best tools we have.
It is about applying the mechanics of everything we discussed today.
The compassionate pile, the logic of CBT, the self-awareness of mindfulness.
Applying all of that to your own internal landscape. And as we wrap up this deep dive, I want to leave you with one final provocative thought to mull over.
Okay.
Clinical literature frequently points out that our modern commercial culture actively encourages people to feel bad about themselves in order to sell them products.
Wow.
Yeah.
Think about that. We live in an economy that literally profits off generating our insecurities and anxiety.
That's true.
If that's the case, is the ultimate mental health treatment really just going to therapy to fix ourselves? Or is it finally deciding to redesign the society we live in?
That is the ultimate question regarding the limits of individual treatment in a structurally flawed world.
Exactly. Sometimes the x-ray is fine, but the room you're standing in is collapsing. Keep questioning the code and keep diving deep. We'll catch you next time.